Today is World Hypertension Day with the theme Measure Your Blood Pressure Accurately, Control It, Live Longer. It's aimed at creating awareness about the importance of accurately measuring blood pressure regularly. It's one of the main risk factors for heart diseases, kidney problems, and dementia. According to experts, hypertension affects more than 30% of the adult population worldwide, which is more than 1 billion people around the world.
For more on this, consultant physician at the CARDIOCARE Multispeciality Hospital, Dr. Oyindamola Awofisoye, joins us in the studio. Well, help us understand. We know that high blood pressure is said to be #1 cause of preventable disease worldwide. Exactly what is high blood pressure? How do we explain it? Because some people still don't understand what it is.
Good evening. Thank you for having me here. High blood pressure refers to a condition where the pressure in our blood vessels, that's a pipe carrying the blood in our body, when the pressure exceeds what it should be, and it poses a threat to the organs in our body. Traditionally, we define high blood pressure as a clinic reading that is greater than 140/90. That's 140 the upper number, 90 the lower number. But we know that the optimal blood pressure, or the best place where the blood pressure should be, is less than 120/80. And by the time you're getting numbers higher than that, it's already going up. But these days, we actually prefer to diagnose blood pressure at least with some components measured out of the office, measured at home, or by doing what we call a ambulatory blood pressure monitoring, in which someone wears a device that checks the pressure for over 24 hours. Okay. And we look at the average, daytime, nights, 24 hours. Okay, so when the blood pressure exceeds these parameters and cuts off, when we say the blood pressure is high. But from practical point of view, sometimes in individual patients, we consider blood pressure to be high when there's a significant clinical benefit in lowering it, when it to do the person far more good than possible harm, then the person has high blood pressure.
Okay, so which means the risk factors would depend on the individual's, constitution.
Absolutely.
Help us understand then, against that backdrop, how should high blood pressure be managed, especially at the individual level?
At the individual level, management of high blood pressure should actually start with prevention. Prevention should occur in everybody, especially by the time we realize we're getting older. If you have one or more family members that have high blood pressure, then you should be on the alert. And even from a young age, we should start adopting healthy lifestyle changes. Having said that, in people who have been found to develop high blood pressure, and then the management is usually by a combination of a healthy diet and what we call the DASH diet, dietary approach to stopping hypertension, adequate amount of exercise, making appropriate lifestyle changes, and then of course in people with hypertension, majority of people will need medications. If they don't need it early, most times people will need it later. So the combination of that is required in managing high blood pressure. But I'll remind our viewers that if you don't check your blood pressure, you'll never know. And a lot of people take pride in saying that I'm not a sick person and you don't go to hospital. I've never had reason to check my blood pressure before and therefore I'm healthy. No. We have to actually, first of all, measure it. That's the starting point. Okay. If we measure it, then we might know.
So some people will say that if anything happens to anybody, the same procedure is standard. So somebody has high blood pressure, this is what they did, and that's what you should do too. Is it same thing applies to everybody, or it's patient to patient, it varies?
Oh, it definitely varies. It varies extremely from patient to patient. I don't know how to describe it more pointedly, but it definitely does vary from patient to patient. So we see that often where we get people that they find out they have high blood pressure and they have one cousin or one uncle somewhere that also has high blood pressure, and they just get the same medication that person is getting. That's totally blatantly wrong, because high blood pressure in one person differs to the other, and then the severity, the factors that are contributing to the blood pressure in that person, the overall cardiovascular risk of that person is likely very different. They're likely different age, maybe different gender, the body mass index may be different, their family history may be different, their lifestyle. So a lot of things can be different, and then the medications they require and the form of treatment they require is likely going to be different.
And then you throw in poverty and then COVID-19 that Nigerians have had to contend with in the last 1 year plus. How does this further complicate the issue of high blood pressure, and really how do we then manage it, especially at the government level? Because we're told that Nigeria does not even have a public, health policy on high blood pressure. With the numbers that I'm seeing, 76.2 million Nigerians out of 200 million actually have IBP.
Yes, so the number is immense, and Nigeria actually, we do have some policy. The Federal Ministry of Health is just the implementation of these policies, like many other things that are supposed to be implemented, has not been as robust as it should have been. And I totally agree with you that poverty is a major factor which we cannot turn a blind eye to. The truth is that the management of high blood pressure is lifelong, and the medications are not cheap. And even the relatively cheaper medications, if you consider the minimum wage in Nigeria, and then you are trying to consider what proportion of a person's income person will be likely spending on high blood pressure medications, then you know that you understand the challenge that many people have in maintaining their blood pressure treatments. And of course, we have the National Health Insurance Scheme, which penetration and the uptake is not as much as we desire. So if you have those kind of social safety nets, it will actually help in at least ameliorating the effects of poverty in management of high blood pressure. Okay,
unfortunately not enough time to know the specifics. We've heard about the need to take salt out of your diet, and all of those things. Thank you so much, Dr. Oyindamola Awofisoye, medical consultant.
Awofisoye.
Thank you very much, medical consultant, internal medicine.